So my name's Tara Lamont. I work at Southampton University and I'm on the board of HCAI UK, as Rich mentioned, which is the National Network for Health Service Researchers and has supported the programme. So why did we pick this as a topic? Well, I think it really is a success story. So many of you will remember 20 years ago, the climate of concern, the headlines around killer superbugs, dirty hospitals, and the the schools of deaths reported at Maidstone Hospital, Stoke Mandeville, and others. And the early 2000s saw various interventions. We're going to hear more about that, from mandatory reporting and measuring to targets to evidence-based bundles and campaigns. And that led to quite dramatic reductions in the reported cases of MRSA and C. difficile. And in fact, trusts met and even exceeded those targets. So I think Ginny and Sally will probably talk more about the policy and service response. I just want to focus very briefly on what research has contributed to our understanding. And it's hard to attribute success to one factor, as these were kind of multifaceted activities. But I wanted to draw particularly on the work of Alison Holmes, a professor of infectious disease at Imperial College, who's carried out a number of important studies, including some funded by the NIHR, and Mary Dixon Woods, who Rich mentioned, gave this fabulous overview this morning, but whose body of work includes an influential evaluation of an ambitious US program to reduce central line infections. So what we know is really through the lens of implementation science and improvement research. And they help us to unpick some of these kind of multifaceted reasons of why and how infection control interventions work. So one key insight from Mary Dixon Woods' work is the importance of the framing of healthcare acquired infection as a social problem in the first place, as a social problem that could be fixed. So we forget that up until a certain point, it was considered to be a problem that was always with us and was unavoidable. So I remember working myself in patient safety at that time, how it suddenly became a patient safety issue. And campaign. So that change in narrative and framing was important in terms of achieving what policy theorists call saliency as a policy and service issue. Alison Holmes in her work points out the mixture of sort of top-down and bottom-up activity in the programme of infection control improvement. And we can also see the importance of clinical leadership at all levels. So within organisations, both as focal points with appointments of directors of infection control reporting to the board, but also more distributed leadership at all levels. But it's also helpful to look at some of the broader theories and understanding of how change happens and how good practice spreads. And you can see what Geoffrey Braithwaite calls a kind of fragile balance between local autonomy and the sort of standardization of a system and the benefits of that tailoring and adaptation. So there's an interesting tension between the standard and the ability of organizations locally to tailor and adapt. And research has also shown us how sort of some of these new ways of working are bedded in or sometimes are resisted due to sort of cultural factors like interprofessional hierarchies and ways of working. So I think research can tell us quite a lot about what worked in this dramatic reduction of healthcare acquired infections. And a topic that's of course assumed new importance at this time, at the time of a pandemic. But I must say, sometimes people talk about HCAI and they say hospital acquired infection. And I think that it reflects much of the evidence that we have is drawn from hospital settings. So we still don't know enough really about how some of these complex interventions work or don't work, and thinking of new interventions around reducing antimicrobial resistance, how they work in community settings and particularly care homes and other high risk areas. So I think I just conclude by saying there's a lot that we know now, but there's a lot more still to learn.